Okay, congratulations on your recent rhinoplasty surgery. I hope you're doing well, and I wish you continued great healing no matter where you are in your recovery. You probably still have some questions, so this video should serve as a supplement to all of the written instructions you were provided, as well as something you can refer back to should you have additional questions that come up later on. But it is super important. If I don't address your concerns in this video or in your paperwork, please don't Google or search online for the answer, all right? There's a ton of misinformation out there and also things that just really aren't relevant for your situation. So instead, please call my office to speak with me or my staff, all right? Let's get started. So the first few days after surgery are your resting days. It's very normal to feel groggy after anesthesia for really up to about 24 hours. So please don't make any important life decisions during this time, all right? Your job at this point is to ice 20 minutes on, 20 minutes off, whenever you're awake for at least the first 3 or 4 days. Swelling typically gets worse over this time, and the more you can ice, the less swelling and bruising you'll have overall. So that means quicker recovery. One thing that seems to work really well is a small bag of frozen peas. It just kind of molds to your face super nice. Do 20 minutes on one side, 20 minutes on the other. That way you can still have one eye kind of open and available to watch TV or interact. Just be careful, don't put any ice on the tape here on top of your cast. That has to stay dry the entire week. Sometimes around day 2 or day 3, one or both eyes may temporarily swell shut. Don't worry, that's okay. It's gonna resolve quickly. It is also common to get very congested and full of mucus during this time. Not only is your nose swelling on the outside, but it's also swelling on the inside. So it's gonna feel like you have a bad cold for a while, all right? A lot of mouth breathing, your throat's gonna get dry. If you have a bedside humidifier, it's not required, but it can often be very helpful. Please do not try to blow your nose for at least 2 or 3 weeks. Now, regarding your dressing, there's some tape here on top of the nose over a splint. This is a rigid splint. This gets kind of custom molded to your nose at the end of the procedure. This is going to be removed along with your stitches around 1 week after surgery. Until then, it's important that you keep it dry so it doesn't fall off too early. You can definitely shower your body as normal, but use a washcloth or something similar to clean your face at the sink. Dry shampoo can be helpful to keep your hair clean, but honestly, no one's gonna care if you just rock a bit of hair grime for a week, all right? Underneath your nose, you will find a small little gauze drip pad like this. It's lightly taped to your cheeks. So light bleeding, kind of a trickle of a nosebleed is very common for the first day or 2. So this dressing simply helps to keep your clothes clean. Go ahead and change it whenever it gets soiled, but once the bleeding stops, it's no longer necessary. If the dressing or the gauze is getting completely red within about 10 minutes, let us know, otherwise not to worry. As far as the inside of your nose, you may have heard or read about some nasal packing. I assure you, you do not have any, okay? So you don't have to worry about getting it removed. Very rarely, I'll use a small splint on the inside to help with healing, but if I used one in your case, obviously I will let you know. Okay, so let's talk about your incisions. The main incision is right here under your nose, and you may also have some small incisions here at the base of your nostrils. If this was a revision surgery, you might also have another incision within your ear, but that'll be obvious. The only thing you really need to do to care for these is apply the antibiotic ointment about 3 times a day. It's best to use a small Q-tip to apply a thin layer just across the incisions and along the inside of each nostril. Don't go any deeper than the head of the Q-tip, all right? Incisions that are kept moist tend to let the sutures come out easier, and more importantly, they heal much better. So make sure they stay covered with the ointment. If you notice some dry crusting somewhere, like on the inside of your nostril, it's okay to dab it with a Q-tip soaked in some hydrogen peroxide, but for the most part, ointment is more than enough to keep things clean. For the inside of your nose, you have a bottle of saline nasal spray. This is really important to help keep the inside moist and minimize crusting. So every hour, just take a few hits kind of on each side. Don't put the nozzle into your nose, just spray for a few times below, just below the nose. There is no medication in this spray, so it's just salt water. You really can't overuse it. All right, speaking of medications, the oral antibiotic is just 3 doses. So it's the night following surgery, the next morning, and then that evening. That's it. You were likely given a prescription for a narcotic pain medication. Obviously, if you need it, please use it. You don't have to be a hero. That said, try to just move to extra strength Tylenol as soon as possible. The other things I find beneficial are the supplements in your paperwork. The arnica and bromelain tabs and the vitamin C. All right, so use these as instructed to really expedite your healing. Lastly, if you normally use a steroid nasal spray in your nose, like for allergies, please hold off on that for at least 4 weeks. All right, regarding your diet, what you're eating, there are no specific restrictions. Soft foods obviously are going to be a little bit easier at first, but really eat whatever you like. Low sodium foods tend to help with swelling, so that's a smart idea. To be honest, you could literally throw a chicken into a blender and it'll be fine, as long as you're eating something. You need to keep your calories up to heal, so it's really, really important. Sometimes dairy foods can increase mucus production and swelling, so it's best to kind of avoid those for the first few days. For a little while after surgery, your upper teeth and your gums may feel tingly, maybe tender. Very common, and that gets better soon. Please continue to avoid smoking, okay, including secondhand smoke and all nicotine products really for at least 2 or 3 weeks minimum after surgery. Obviously, I wouldn't be a good doctor if I didn't tell you to not smoke, so please don't. The ingredients cause blood vessels to constrict, which basically strangulates your nose. It can cause ischemia and necrosis, so it just jeopardizes your results. As for sleeping, it's best to sleep with your head elevated a bit, either several pillows or a recliner. This can significantly help minimize swelling. If you can sleep on your back, obviously that's best, but sleep is essential for healing. So really just do whatever you need to get some rest. That said, for the first week, you'll likely be taking more cat naps throughout the day rather than your normal 8-hour beauty rest. So try not to get frustrated, just be patient with yourself at night, all right? Your body knows what to do. I get frequent questions about glasses. So if you wear glasses, it's important that they not rest directly on your nasal bones for the first 4 weeks after surgery. The first week, obviously, you'll have your splint there, and it's fine. The glasses can just rest right on top of the splint. But after that's removed at 1 week, just remind me, and I'll make sure that you get an extra splint to wear on top of your nose, and you just put your glasses on top of that until you're a month out. Obviously, if you wear contacts, then that's an easy option as well. As for activity, as I mentioned, the first few days, you're kind of a couch potato. So that said, it's critical that you still get up about every 30 minutes or so and just kind of walk around, stretch the legs, take deep breaths. I don't want you developing a blood clot or anything. So binging Netflix for 8 hours, for example, is fine, but just take frequent breaks. Remember, swelling and fatigue typically get worse over the first 3 or 5 days. So don't be surprised if you're feeling pretty good after surgery and then start getting more run down. That's totally normal. Hang in there and you'll be turning the corner soon enough. As for exercise, light cardio can typically be started about 2 weeks after. Moderately strenuous exercise like light weights or circuit, I want you to wait at least 3 weeks. Really aggressive workouts like CrossFit or super heavy powerlifting, please wait at least 4 to 6 weeks. Start slow and just build yourself back up as your body allows. Contact sports or anything that risks nasal trauma, please wait at least 6 weeks. All right, what to expect going forward. For the first week especially, things can look and feel very strange, but this has nothing at all to do with the end result, all right? Most patients feel presentable or kind of comfortable in public around 2 to 3 weeks. This is what I call restaurant ready. Things will still kind of feel and look weird to you, but really no one else is gonna care. Asymmetry, mild persistent swelling, and some anxiety are all very normal at this point. At 1 month, it will just look like a normal nose. You will probably still feel like it's a little bit big, and I'll just agree with you. It's just mild swelling, which will continue to get better. 3 months is when patients really start to love the results, especially in photos. Still though, that's the early phases of healing, and you'd be surprised to see how much improvement is still to come. It's expected that you'll notice fluctuations in swelling and sensation throughout this time, but your nose will get better and better over the course of the year. It'll continue actually to heal for really up to 3 years or more. Throughout the year, we'll see each other frequently to make sure you're on track, and if needed, I can do some injections of anti-inflammatories directly into your nose to help things along. This is a process, and there isn't really too much you need to do to make it go any quicker. One thing you can do to help is avoid prolonged sun exposure. Obviously, stepping outside isn't a problem, but if you're gonna spend any significant time in the sun, going to the beach, vacation, whatever, please use a sunscreen and a big hat, okay? Sun exposure causes a ton of inflammation in the nose, which just means prolonged swelling. Anywhere there's swelling, the body can deposit scar tissue. More scar tissue means a less refined result. So please be smart about the sun. That's really it. The rest is just a waiting game. We're gonna be good friends throughout the next year, and I'm excited and honored to be a part of this journey with you. I stand by my results, and I can't wait for you to see the nose that you've been dreaming about. So keep up the positive attitude. We'll be there before you know it. Happy healing.